There's a 2015 article in Forbes magazine written by Dan Monroe that states that the Office of Civil Rights reported 253 healthcare organization data breaches affecting over 500 individuals with a loss of 112 million records. According to this report, the highest incidence of data breaches were caused by unauthorized access due to hacking or theft. These are alarming statistics. There are a great deal of data breaches that are affecting millions of people. In a 2014 Health IT News article written by Aaron McCann, it states that a lot of data breaches go unreported because healthcare organizations are only required to report if it affects over 500 individuals. All of us feel that our health information should be kept private, and we should have the right to restrict access to our medical information. Which leads me to the topic I'd like to discuss today, HIPAA. What is HIPAA? Health Insurance Portability and Accountability Act. It was a law passed in 1996 designed to protect patients' rights to privacy. You can go on the Department of Health and Human Services website, hhs.gov, and look at a 2008 article called Your Rights Under HIPAA for more information. I'm a health information management student, and during the course of our studies we have learned about HIPAA rules and regulations and what it means to patients' privacy. A little history about HIPAA. There's an article written in 2009 called Beyond the HIPAA Privacy Rule by Cheryl Nass, and it states that when HIPAA was first enacted into law, it had two goals in mind. One was to increase the efficiency of healthcare, and the other was to increase the number of individuals that had health insurance coverage. Congress decided that it was also important to protect patients' rights to privacy, so they added the privacy and security rule to HIPAA. And that's what I'd like to talk to you about today. First of all is, what does HIPAA cover? Second is, what are your rights as patients? And third, what is healthcare organizations' responsibility towards you to keep your information private? What kind of information does it cover? Any personally identifiable information that ties to your medical record. So that would mean any information kept in your medical record, all conversations between you and your healthcare provider. Also, any medical information that's stored electronically, either at the healthcare organization or at your health insurer's computer. What are your rights as patients? You have the right to get copies of your records. You have the right to make sure that your records are correct and request corrections if needed. And also, most importantly, you have the right to restrict access to your medical records. On the website americanbar.org, it talks about, on an ABA eSource article, the Notice of Privacy Practices. There was an omnibus rule that was passed to increase what they had in the Notice of Privacy Practice. This is the piece of paper that they hand you when you walk into a doctor's office that tells you what they do with your information. Healthcare organizations are required to inform patients of how their medical information is used. Typically, it's treatment, payment, and operations. Treatment, the doctor needs to know your information in order to treat you properly. Payment would be if they're filing insurance information for you. An operation has to do with reporting to regulatory agencies regarding quality of care, and then public health agencies because of the infectious disease reporting requirements. So that's what the Notice of Privacy Practice is. So you need to read over that when you get it, and if there's any place that they're going to be sharing your information with that you don't want them to share, you can restrict access to that. Now that leads me to what healthcare organizations' responsibility are to you. They have administrative, physical, and technical safeguards, and they are required by law to make sure that they keep your health information private. If they don't, there are penalties, financial penalties, and also prison time if it was a deliberate breach of your information. The administrative safeguards have to do with workforce training. Physical has to do with locks on the doors, keeping workstations secure, paper records that are stored in a medical record room, they have to have that lock and only have certain people have access. Technical safeguards has to do with password protection and access control. So with this in mind, in conclusion, it's important that you know what your rights are as patients to keep your information private, what HIPAA's rules and regulations are, and who you can report to. If you feel like your information has been breached in any way, you can go to hhs.gov. The Office of Civil Rights is who you report data breaches to, or you can go to your privacy officer, the privacy officer of the healthcare organization in which you're being treated. I hope that this has given you more information about what HIPAA is, what it stands for, what it covers as far as what your rights are as patients, and that it is important that you know what kind of medical information is being shared with other entities and that you have the right to restrict that access. Thank you.